Good morning. This is Dr. Geary again. Just want to give you an update on my COVID immunization status. First off, thank you all for the comments, questions, suggestions that I've received. I'm hoping that I can be a benefit to you. Again, my job is just to inform you, present you the facts and the data, and help you make a more informed decision regarding the COVID immunization. So, I am feeling fine. I received my COVID vaccine exactly 1 week ago, December 5th. Today is day 7. Initially, I had some arm soreness, roughly about 3 days. Worst day was probably day 1 and day 2. I didn't have any fatigue, any fevers, any malaise, no change in appetite. There was really no additional symptoms reported. And I'm actually back to my baseline. So I do feel good today. I feel excellent today, guys. And I am scheduled to receive my booster on February 2nd, and exactly 4 weeks after the first dose. Again, I did receive the Moderna immunization, and I do plan on going back, given that there is enough vaccines left for the booster on February 2nd. Now, I've gotten a lot of questions regarding my child being at home, learning at home in a virtual environment, and parents are noticing changes, predominantly a change in weight. And we are seeing an increase in childhood obesity since the beginning of this pandemic. I've seen many references referring to the quarantine 15. The average child will gain roughly 15 pounds since the start of this pandemic. And I'd say it's anywhere between 5 and 15 pounds, in some cases even higher than that. So what can you do to kind of curb this obesity epidemic during this pandemic? Now, we still want to encourage 60 minutes a day of physical activity. I know this may be harder given that the child is not going to school, is not switching classes, is not attending gym class. But we still would recommend the 60 minutes of physical activity a day. If this is going for light walks outside, if this is doing some light exercises in the home, but something to get that heart rate up as far as exercise. Be very cognizant of the dietary intake, especially during these times. Again, parents may not be home. Provide healthy, nutritious snacks for your child to snack on while in front of the computer. And then encourage the children to be active, to take breaks throughout the day while they're learning if you cannot be at home with your child. But we really want to limit this obesity mini epidemic during this pandemic in any way we can. But physical activity and healthy, nutritious snacks are two ways that we can hopefully offset this childhood obesity epidemic during this pandemic. Many parents have asked me, so is it okay to bring my child to school? Could we do the hybrid, some virtual, some in-person learning? And there were a couple of studies, I'm sure there are going to be many more studies to come about, of looking at COVID infections in the school settings. Now, Duke University did a significant study over this summer, or over this fall, I should say, looking at over 100,000 students in the North Carolina area for a total of 9 weeks. There were a total of 32 cases of COVID-19. Now, given this wasn't during the current increase in the number of cases, so these numbers could actually be higher now. But of the 32 cases that they did find, 6 of them were in kindergartners, 11 of them were in the elementary schools, 6 in the middle schools, 5 in the high schools, and 4 were found in schools that had grades K through 12. What they found, this include the mask coverings for children 5 years and older, 6 feet social distancing, hand washing, daily symptom monitoring, and temperature checks as well. Most important part was transparency when reporting infections. Also, parents not sending a sick child to school. One thing to note that there were no child to adult infections in this study. So what does this tell us? The adults or teachers or administrators are giving it to the children. This prompts a discussion perhaps that teachers should be on that high priority list as receiving the COVID-19 immunizations. Now, I know that will stir up a lot of discussions and debates, given that many teachers are apprehensive regarding the immunization. But just looking at this study, you can protect your children, your students in the schools by receiving the COVID-19 immunization. So something to think about. Now, when can my child receive the COVID vaccine? I've received a lot of questions regarding this as well. Now, currently, there are no vaccines indicated for children. One of the Moderna trials, the youngest participant was 16 years of age. So we do need more data before we can feel safe in administering the COVID-19 immunization to children. This is just to ensure safety and efficacy. Remember, children are just not small adults. We need to make sure the vaccine works well in children, teens, young adults, as effective as it is in older adults as well. So more data is needed on vaccines before we can give it to our younger patients. So when will this be available? Again, many of the companies are in the process of doing clinical trials as we speak. Janssen, one particular company, is looking at a single dose immunization for COVID-19 infections. It may be possible that we have an immunization for children before the 2021-22 school year. So we may be a ways away from the immunization. My guess, just looking at the data so far, as next fall, we should be starting to administer COVID-19 immunizations to children. And will it be mandatory? Again, the vaccine is not even out or indicated for children at this time, and that will be up to the specific state's government regarding the decision to make the vaccines required for school entry. What's the current status of COVID-19 research in children and adults? Again, Pfizer has enrolled children down to age 12, and it's the emergency use authorization for vaccines now indicates it down to age 16, was recently approved. Moderna is currently doing a similar study, and as I mentioned before, Janssen is looking at a study in children with single doses. AstraZeneca has approval to enroll children in the UK starting as young as 5 years of age, but has yet to enroll any children in the US. But we anticipate much more clinical trials involving younger children in the United States in the upcoming months. So stay tuned for more information. I've received many questions regarding any data for pregnant women or women that are breastfeeding. To date, there is no concrete data on COVID-19 immunization and pregnancy. However, during the clinical trials, when we were immunizing participants, some of the women did become pregnant, and those women are currently being followed for any complications during the pregnancy, delivery, or any complications to the baby as well. So currently there is no substantial safety data in pregnant women, the fetus, or infants at this time. However, ACOG, the American College of Obstetricians and Gynecologists, has released a couple of statements indicating that COVID-19 vaccine should not be withheld from pregnant individuals who meet criteria for vaccination, which is high-risk groups, healthcare workers, first responders, etc. Also, COVID-19 immunizations should be offered to lactating individuals similar to non-lactating individuals that meet the criteria for the immunization. Again, personally, I would ask your obstetrician if the immunization is safe and is recommended for you in your specific case if you're thinking about getting the COVID-19 vaccine. And once I do receive it, how quickly does it work? How long does it last? We currently don't know how long the immunization lasts for, but we do know roughly 7 to 14 days after the second dose is likely how long it takes to get the levels of the neutralizing antibodies. So given 2 weeks after you receive your second dose, you should be that 94-95% protected against COVID-19 infection and some of the variants that have been coming across in the literature as well. Pfizer released data showing that efficacy again starts to show in the second week after that first dose, affirming roughly that 14-day window after the second dose. And again, because this really began less than a year ago as far as this pandemic, we really don't know how long the immunity will last for. So I will keep you updated on that as well. And lastly, I do want to mention COVID immunization and the impact of minorities, both the vaccine and the disease. As you may be well aware by this time, Black Americans 3 times as likely to become infected with COVID-19 compared with white Americans. Black Americans are also twice as likely to die from COVID-19 compared with white Americans. A recent study, the COVID-19 tracking survey, 35% of respondents would not get any of the free FDA authorized immunizations for COVID-19. But what really stood out to me, I should say, was the fact that white respondents were more likely to receive the immunization compared to black respondents, 67 compared to 59% respectively. Given the data that I presented, blacks are 3 times as likely to get the COVID-19 infection and twice as likely to die from that. Why is it that blacks or African Americans are less likely to agree to the COVID-19 immunization? I understand the historical significance, the mistrust, the Tuskegee, the Dr. Marion Sims, and the gynecological experiments, but this is a different time. As you can see, many of other groups outside of African Americans are receiving the immunization at higher rates and higher numbers than blacks are. I really plea out there, please do your part, protect yourself, protect others around you that may not be eligible for the immunization. Again, I'm here to hopefully answer questions, comments that you may have regarding COVID immunization or COVID-19 infection. As always, I welcome any questions and comments. Feel free to contact me. Contact at gearingpediatrics.com, my website, gearingpediatrics.com, or you can follow me on Facebook as well. Take care and be well.